Okay, we'll talk about drowning and then we'll do CPR. So drowning, interestingly, is the lead cause of death in young boys. What's the age? It's little boys and young male adults. If we go back to our World Health Organization list at the beginning of the book, and that's interesting to me because most people don't live near water. But one of the reasons why it happens is because of water tanks, cleaning water tanks, climbing into any kind of water, going into any sort of a pool activity, because people don't know how to swim and they don't know how hard it is to swim. And also when you're little, if you're a little kid and you're messing around at the water tank, we just had one of our people on our team who's a community health worker was called to the death of a little 4-year-old, right? Yes. A little boy who'd fallen in the water tank and nobody knew where the kid was for 4 hours and they found him. It was obviously way too late. But for our students, people that are cognizant and that we can teach them some skills, there are skills that you can teach kids that don't involve having to have water to help them if they ever get in a water emergency. The first and most important one is never swim alone. It's so easy to think that you can make it across the river or you can do your Olympics or whatever, but you always should have a buddy with you in the water or somebody looking from the shore whose job it is to make sure. It's that thing when you've got a bunch of kids, you count the kids and then in a minute you count the kids again and sort of keep counting the kids. So that's really the most important thing, is make sure that you never swim alone. If you do swim and you start to get in trouble, like you're being carried out or you realize that your feet can't touch the bottom, just like every emergency, the first rule is to stay calm. Because if you start thrashing around and you're kicking and yelling, two things are happening. First of all, you're using up your air and you need air, right? And second of all, you're exhausting yourself because you're kicking and you're not going to push yourself out of the water. When little children drown, it's silent. They just go down and they lose their bearings and they don't know where up is and what down is, and they just never come up for air again. So drowning is actually a very quiet event. In the movies, it looks all dramatic and splashy, but that's not how it is in real life at all. I've seen a kid almost drown and it was literally silent. And they were right below the surface of the water. It was like they were stuck. There was a piece of glass between them and the air. It was actually incredibly scary. So it's a very, very quiet act. Don't swim alone. If you get in a drowning situation, stay calm and don't thrash and don't kick. Stay calm, work to keep your head above water, and then the last thing is to remember that our lungs are full of air, right? And air floats, right? So we can use our lungs as a life preserver if we stay calm and keep them full of air. And in your student health club book, there's a little demonstration activity that the kids will be able to do that also demonstrates the purpose of the lungs. This plastic bag is slowly sinking. It's not sinking very fast, but the crumpled up one, because it doesn't have a lot of air in it, right? And that's what our lungs look like if we breathe out all the air, and they don't float very well, obviously. But look, this bag is holding air in it, and do you see how it floats on top of the water? So that's exactly true of our lungs. So if we can keep our lungs full of air, then we will naturally float to the top of the water, just so long as we're not kicking our legs around too hard. And that's a skill you can teach people without any water at all. So you can literally have them lie on a table with their arms and legs hanging out and then feel the sensation of breathing full of air. Can you guys see or feel it in yourself? That when you breathe your mouth full of air, your lungs expand because they're filling with air. And this very air will let you float. So what floating in the water is you literally let your arms and legs just flop and rest. They're going to float a little bit naturally. And then you make sure that through your mouth you keep expanding your lungs full of air. And you can't pull all the air out of your lungs when you exhale, so it's fine to exhale. We still need oxygen to exchange into our muscles and our brain and the rest of our body. But that process of continuing to slowly inhale and exhale while staying calm will keep somebody floating on the top of the surface of the water long enough that somebody else can come and rescue them. If you're the rescuer, never do that alone. First of all, if you jump into the water with somebody who's panicked and swimming, they will grab on top of you because they'll do anything to get out of the water. That's actually happened to me. I don't know if anybody's ever happened. That's just a survival mechanism. So you don't want to be the only person going in. It's much better to hook that person with something or throw them something so that they can start to help themselves, unless you have two people. And then when you have 2 people, you can typically support somebody and help them get out of the water. Okay? So I'm going to show you this video right now that's in our Student Health Handbook, and also in the, this is another great thing to show the students, but it's got demonstrations of floating in it.
Your organization's expenses can be difficult and
And a commercial.
invoices to your employees.
Because of
waiting for
course.
payment.
Hi, this is Miss Jen, and this is Skills for Super Swimmers. Back floats are the most important safety skill to learn in the water. They can be done in any situation, and when done properly, they require little to no effort. To do a back float, lie back in the water, distributing your weight like an X or a starfish. Don't be a taco, even if it's Tuesday.
See how he's
Chin
struggling?
and hips up to the sky. Remain flat like a pizza. The magic is in the chin. Keep your eyes open. Breathe in through your mouth and out through your nose. Your lungs are like a gas tank, always breathing in a little more than you're breathing out. Work on those back floats to be more pool safe, lake safe, ocean safe. You get the point. Stay safe, super swimmers.
Do you see how those people's lungs, when they breathe in, it naturally causes them to float? So that's literally a skill you can teach anybody. You don't have to be in a pool. And it's a great skill for everyone to have. I will admit that a person would have to have astonishing presence of mind to float if it was the very first time that they've ever been in the water, but it's definitely worth teaching. It's another skill to teach if you've got kids that you're supervising in a swimming pool. Just have everybody demonstrate to you that they know how to float. And that's a great way if you go on an outing with your students to make sure that people have that first important skill. Drowning is the only time now in our changed view of CPR that people should do mouth breaths, breathing in before you start the CPR. You know how it used to be 2 breaths and 32 compressions, and then breathe again and 32 compressions, and that's dangerous because of HIV and infection and all sorts of things. It also doesn't work very well. You have to be very well trained, as Addison and I've talked about so many times, in order to actually get air into somebody's lungs by breathing into them. But in drowning, it's important to do it, not just to get air into the lungs, but because of that tracheospasm I talked to you about. If you blow air into somebody's lungs even a little bit, it will relax that spasm in the trachea, and so the person will be able to start breathing on their own. You don't have to Heimlich them. You don't have to try to get water out of their lungs, because how much water do we say goes into their lungs? 1/4 cup before they spasm. So just a tiny, tiny little bit, half this, is what goes into people's lungs. And so we don't have to worry about Heimliching. So you'll do, is it 5 rescue breaths? Yep. So you do 5 rescue breaths before you begin the CPR. To do a rescue breath, the person is lying on their back, not in the recovery position, because you've got to administer first aid to them. They're lying on their back. You tip their head back a little tiny bit, pinch their nose shut, open your mouth and their mouth, and breathe hard. It's really hard. It's like blowing up a balloon times 1,000. And your purpose is just trying to get some air into the lungs so that trachea relaxes, okay? So drowning is the only time where you do 5 rescue breaths. And I'm telling you that because drowning is one of the most common causes of death of boys and young men, and so we should all know that answer.